This episode is sponsored by Awesome Socks Club, a sock subscription for charity. Today is the final day to sign up, so click the link in the description now to get lots of cool socks in 2021. There's a lot of talk about viruses and vaccines these days, but COVID-19 isn't the only thing in need of a breakthrough. New research published in Nature Medicine brings us one step closer to one of the holy grails of medicine: a universal vaccine for the flu. Seasonal influenza causes hundreds of thousands of deaths every year, and occasional flu pandemics can be much worse. And unlike many diseases where one vaccine does the trick, the flu forces us to keep producing new vaccines every year. That's because there are many variants of the flu virus, and even those are constantly changing. A vaccine's job is to teach your immune system to recognize an infectious agent like a virus and respond to it when it enters your body. There are a few ways to do this, like with an intact but weakened form of the virus or just a small piece of it. Once your immune system has fought off the decoy, it's primed to do so again more quickly and effectively when the real infection comes along. Flu vaccines are often designed to target a protein called hemagglutinin, or HA for short. This is a structure on the virus that lets it attach to cells during infection. HA is shaped sort of like a skinny mushroom with a head and stalk. That head is the easiest part for antibodies to reach, so our immune system tends to target it, and our vaccines are designed to do so as well. But as new flu strains and subtypes evolve year after year, the HA head keeps changing. Probably for the same reason. Our antibodies learn to spot it, so the virus changes to evade them. Which means researchers have to design yearly flu shots based on what HAs they think will be kicking around out there. And as the virus continues to mutate, our flu shots can no longer show our immune system what it looks like. This new study reports a clinical trial of a vaccine that instead targets the stalk, which varies far less across different flu strains. Which might be because it faces less pressure from our immune systems, or that it needs a very specific shape to do its job, so it can't mutate or it'll break, or both. This was a phase 1 trial that included 65 human participants, which showed that the vaccine was safe and produced a strong immune response that lasted at least 18 months. Now, as we've said a few times this year as we've followed the development of COVID vaccines, phase 1 trials are just the first step of human testing. Next, the researchers will move on to bigger phase 2 and 3 trials to rule out rare side effects and continue to demonstrate efficacy. The researchers also point out that this version of the vaccine only works against certain types of HA proteins called Group 1 HAs, which means this isn't a universal flu vaccine yet, but research is underway to broaden the scope of this vaccine to theoretically make it work against a wide variety of flu viruses, even new pandemic strains. It's a step towards a universal flu vaccine, which would save a lot of lives, not to mention the convenience and reduced cost of only needing one vaccine. In order to defend against a disease, we need to understand how it works, but that's not always easy. In another new study published in the Lancet Microbe, researchers have discovered a series of mutations that might help explain why certain common bacteria are harmless to most people, but deadly to others. The bacteria in question are Neisseria meningitidis, and they're found in the noses of 10 to 15% of the human population. Most of the time, these bacteria are no problem, but in some cases, they can cause bacterial meningitis, an infection that can affect the central nervous system and cause death within hours. In this new study, researchers compared harmless and harmful versions of the bacteria and found a surprising difference in their RNA. RNA is a molecule similar to DNA, and one of its main jobs is to convert the messages contained in the genetic code into proteins. But RNA can also have non-coding jobs, such as regulating when cells perform certain functions. In this case, they were looking at RNA thermosensors, a form of RNA that alters cellular activity in response to temperature. After looking at thousands of RNA variants, the researchers identified 5 versions of RNA thermosensors that seem to be more common in bacteria that cause meningitis. These RNA variants seem to help the bacteria protect themselves. In order to evade our immune system, the bacteria form protective capsules around themselves. These mutated forms of RNA all help the bacteria produce particularly large and numerous defensive capsules. Being able to activate these capsules in response to temperature might help the bacteria survive in the warm depths of our nasal cavities, not to mention when our bodies run a fever during infection. This discovery gives us a molecular warning sign to look out for. The researchers designed a method to screen bacteria for these RNA variants, which in the future could be worked into a medical test that doctors could use to spot these harmful microbes before a severe infection takes hold. Now, this is the first time that a non-coding RNA molecule has been found to be involved in bacterial disease progression in humans, so it might also help guide future research to similar unexpected clues. Cutting-edge research isn't the only way to improve global health. You Yes, you can help too, and score neat socks in the bargain. I'm talking about DFTBA's Awesome Socks Club, a charity sock subscription where you get a fun pair of socks designed by a different designer every month in 2021. 100% of the after-tax profits go to decrease maternal and child mortality in Sierra Leone, which is one of the most dangerous places to be pregnant in the world. The catch is that you have to order by today, December 11th, so we know how many socks to make. You can learn more at awesomesocks.club/SciShow.